Hello and welcome. Let's take a look at our top story this hour. India has logged 3,016 new COVID cases in the last 24 hours, a jump of 40% in daily cases. According to the Union Health Ministry, now the number of active cases has increased to over 13,500, which is the highest case count seen in almost 6 months. In the last 24 hours, a total of 14 new deaths were also recorded, including 8 from Kerala, 3 from Maharashtra, 2 from Delhi and 1 from Himachal Pradesh. The maximum cases of COVID-19 have been reported in Kerala with 686 cases, Maharashtra with 483 new cases, followed by 483 new cases, and then Delhi with 300 new COVID-19 cases. Meanwhile, Karnataka and Kerala both have logged 215 and 112 COVID cases respectively.
"112 new coronavirus cases have been reported from the southern Indian state of Tamil Nadu. This takes the total tally of active cases to close to 700. We have to keep in mind that the testing rate on a daily basis is close to 3,000 tests, so the numbers actually could be slightly higher. However, this is no reason to get alarmed or panic because of the fact that most of the cases being reported in these days are of the mild type and there is no hospitalization required. And even in the rare cases of hospitalization, there is no intensive care or oxygen support being provided. At the same time, people have to take precautions. The authorities have recommended that people wear masks while stepping out and also ensure that they maintain adequate social distancing and personal hygiene. Particularly in the case of those with comorbidities or pre-existing ailments, it's been suggested that they avoid gatherings in public spaces, particularly those in closed spaces. From Chennai, Siddharth MP, WION World is One.
Meanwhile, the World Health Organization has changed its recommendation for COVID-19 vaccines, suggesting that high-risk populations should receive an additional dose 12 months after their last booster. Now, for more on this, we are being joined by our principal diplomatic correspondent, Siddhant Sibal from New Delhi. Hello to you, Siddhant. The biggest number of cases seen in India in 6 months. Is this a cause for concern? What are the latest details that you have for us?
Yes, Alison, it is a cause of concern, but not a cause to panic. We know the authorities have been holding meetings. In fact, if we talk about Delhi, the national capital of India, there have been spike in cases, almost 300 cases being reported just on Wednesday. This is the highest number of cases reported since September. And of course, the authorities here have been holding meetings, and there will be another important meeting led by the Chief Minister very soon. But if we talk about what the government is, the center, the Prime Minister Narendra Modi-led government has been doing. There have been a meeting, and the big focus is to prepare for any contingency. We know in the past there have been devastating waves of COVID here in India, and India, of course, this time is keen that if in case there is a major crisis, there is no shortage of oxygen and other related facilities. But largely the message from the government is that when it comes to the social distancing, wearing masks, this is something that should be followed. But largely, as I said by starting the comment, that yes, it's a cause of concern, but it's not a cause to panic.
WION, now available in your country. Download the app now. Get all the news on the move.